Hi, and thanks for joining us on another episode of We Are In This Together. The video log, I was going to say podcast, but you can see us, so it's not a podcast, but looking at how to stay safe and healthy during COVID-19. This week, we're going to talk about something other than just COVID. We're going to look at dengue as well. But before we get into that, I want to introduce you to my guest. She's joined us on the show before, but Hannah's joining us. So Hannah works as part of our health department. And it's her job to support us in sort of health policy and what we need to make sure we are being safe and healthy during this time. So Hannah, can you just welcome to the show? Sorry, thank you very much for joining us. But can you give us a little bit of rundown of what your role is during this time?
Sure, thank you very much. I'm happy to be back at the show. My name is Hannah Frerichs, and I am working here in Panama at the regional office in the health unit as an emergency health officer, but I am also the health liaison between the English-speaking Caribbean and the regional office. So I work with all the national societies in the Caribbean, and we support them wherever we can in all things concerning health.
Yeah, that's great. And so obviously speaking about health, often in the show, always in the show, we touch on COVID-19. But before we talk in depth about COVID-19 today, let's talk a little bit about dengue. So I know some people know what it is, but can you just remind us what exactly is dengue and where are we starting to see it crop up?
Yeah, dengue is actually the fastest growing tropical disease in our world. And it mostly comes up during the warmer, rainier seasons of the year. So there is this seasonal pattern of the disease. And so, for example, here in the Caribbean, it's mostly in the beginning of the year and peaks in August, and then it slowly decreases again. And in our area alone, there are more than 500 million people at risk for dengue. There are only two countries, Canada and Chile, continental Chile, that are free of dengue. And Uruguay doesn't have dengue, but it actually has the vector that gives us dengue. But I'm going to talk about this later a little bit more. Okay, and severe dengue is actually a leading cause of serious illness and death in many countries here in the region. But lately, you don't hear so much about it anymore because there's other topics in the news, mainly COVID, of course. But maybe last year, somebody has read it in the news that it was the largest number of dengue cases ever reported globally. And here in our region alone, more than 3 million people got infected. So this is actually a really large number. And in this year as well, in the first 7 months of the year, I think, we've had historical records of dengue outbreaks in the region and in the rest of the world as well. And one major reason for this is the climate change, because the climate gets warmer with more rain, and the mosquito, which is the way of transmission, loves this temperature. And if you allow me to talk a little bit more about the way of transmission.
I was going to say, you mentioned mosquitoes. Can you tell me a little bit about how that all works? Like how can I get it?
Yes. So dengue, like malaria or yellow fever, is a mosquito-borne disease. It's a viral infection that you get through the bite of an infected mosquito. And this mosquito is from the type Aedes aegypti, which is also the same mosquito that gives you yellow fever, chikungunya, Zika, and some other viral diseases. So it's very common and it's very bad for us. This little mosquito is mostly active in the early mornings or at dusk, but it will also seek blood in other times of the day. Just those two parts of the day they are most active, but it doesn't mean they cannot bite you during the rest of the day. So it cannot be transmitted from one person to another directly if this mosquito is not there. But if, for example, you have it and you live together with your family and you don't use any measures of protection, and you have mosquitoes in your house, there's a good chance that the other people in your family could get it as well. because there are mosquitoes flying between each of you, and then they may bite you first, and then they'll bite your husband, and then your husband could get it as well. So yeah, there's not direct transmission, but because mosquitoes fly in the same house, it might as well happen.
And we will get into some of those protection measures you're talking about in a minute. But just before we get there, can you tell me a little bit about like symptoms? How would you know if you had dengue? Like, what does that look like in people?
So normally, after you've been bitten by an infected mosquito, it takes a couple of days after you notice it. And then the main symptoms are fever, severe pain in muscles and joints. This is also why it is called the break bone fever, because it's so painful. It also gives you a headache, particular behind your eyes, and you might experience a red and itchy rash. Also vomiting, nausea is really common. And what is not as what not so many people know is that 25% of the cases actually also have cough symptoms. So they have respiratory tract symptoms as well, like anything in your in this area, like your throat, your nose, could be affected. And if you get the really, really severe form, which affects about 5% of the patients, you can have really, really high fever, severe abdominal pains, and bleeding in your mouth, from your nose, in your stomach. So you might be vomiting blood, actually, or passing blood to your stool, and it can also impair your organs. So if you get the severe form, it is really life-threatening.
Oh, wow. You mentioned about coughing and fever. That's a lot of what we're talking about with COVID. Is that sort of like some similarities we're seeing, like just as far as symptoms or how people are feeling?
Unfortunately, yes, which doesn't make it easier, because there are actually a couple of symptoms that are also seen in COVID patients. For example, fever, headache, pains, vomiting, and nausea. It's all the same. The severe form of COVID, people have pain in their chest, which could happen in dengue as well. There are a couple of symptoms that come up in COVID that don't come up in dengue, like the shortness of breath, difficulty breathing, and loss of taste or smell, which is really particular. But especially in children that have COVID, many actually don't experience any cough or respiratory tract symptoms. So you could easily think, oh, it is COVID, but then it's dengue, or the other way around. And it is actually really important, if you have any symptoms at all, that you talk to a medical professional about it, so that he or she can take the tests and see what it really is, to treat the person accordingly afterwards.
And I was just going to say, even if you have sort of low-grade symptoms, I'm just thinking back on dengue here. So even if you're thinking like, oh, it's not that bad, I'm fine. My understanding is if you get it again, you can be quite sick the second time. So it is really important, as you're saying, to get some of that medical advice.
Yeah, exactly. Especially, I mean, it is only 5% if the dengue cases that get to the severe form, but still it is better to know if you have it, so the medical professional can continuously check up on you if you're worsening, if you need maybe some fluids or something like this because of your vomiting, or some painkillers or something like this. So it is definitely better to get tested. But of course, in health facilities that are already overwhelmed by COVID patients, there's this organizational bottleneck. Let's call it like this, where they have already so much to do with the COVID patients that they might not have the time to take care of the dengue patients, or in another scenario, that people who experience only mild symptoms of dengue think, it's not that bad, and I really don't want to get COVID, so I'm not going to the health facility right now because I'm going to get COVID there. And it's not worth it for me because I'm not feeling so bad. So I'm just staying in the house, and we'll see, it will get better by itself. And this is not the right thing to do.
Yeah. So that's obviously a key piece in making sure you get treated. Can you speak to how we would avoid getting dengue to begin with?
Yeah, sure. First of all, the most important point is eliminate this mosquito. And to do that, it is really crucial to remove all open containers that have any stagnant water in them, in your house, around your house, in your gardens. And that can be, for example, flower pots, or those little plates you put underneath flower pots. So when you give them water, that the water is not flowing out, but stays a little bit there. I mean, even I have them, but then you have to treat this water in there with larvicides. Did I pronounce that correctly? Is this little poison that you can put inside, so the mosquitoes cannot lay their eggs inside that water. But many people, I don't know, they have maybe something in their garden where a little bit of water can come in, and they don't even see that. So it is really, really important to check your house and your garden, your surroundings on a regular basis. If there's maybe little containers of water, stagnant water, and then just put it away. Also, if you have
mosquitoes from laying eggs, that's like the goal of all of that, right?
Exactly. Because I mean, a mosquito itself doesn't live that long, but the problem is that it has laid so many eggs before it dies, and we don't want that. So if you, for example, have a water container for drinking water or for showering, make sure that it's really tightly covered. And for windows and doors, use screens wherever possible, for your bed as well. And there are these mosquito nets that are treated with this long-lasted insecticide spray. Those are really useful. And it's especially important if somebody in your family has dengue, that he or she sleeps under a bed net, so that the mosquitoes cannot bite that person and then give it to another person that's still healthy in the family. And in general, I think that public authorities have to take care that these strategic services, like for vector control, like waste management and maintenance of public spaces, that this is still working. And I know that especially now in COVID times, this was something that maybe got neglected a little bit, because people just had other things to think about, and so many things on their mind, that these interventions that happened on a regular basis before were radically reduced. Maybe also because people were in lockdown. People were not allowed to leave their houses anymore. This is all factors that play into that. For example, the Red Cross, I know we have many volunteers that are working in the vector control, and that go to the communities on a regular basis, to talk to them, to train them. But this had all to be reduced due to COVID. And many people that worked in dengue before are now working on COVID, not working in dengue anymore. It is very, very important that we don't forget about dengue. And even if, like, the Red Cross volunteers can't work in that right now, that communities themselves, they have to keep it in mind. Hey, I have to keep my garden clean. I have to keep my house
clean.
My neighborhood clean, and I have to keep my doors and my windows locked.
I
And
think we are even starting to see that. I know in some communities, in some of the islands is where the communities are starting to do community cleanups for this exact reason. And I know we're talking a lot about dengue today, but we do call this, we are in this together because we are supposed to also mention COVID. So we're talking about how to stay safe from dengue. Let's also just do the quick reminder on the best ways of preventing COVID transmission. Can you give us the reminder on that?
of course. Well, most importantly, keep your distance. The maximal distance possible and never less than 1 meter. Better 1.5 meters. Actually, I'm not sure how much that is in feet, but
like 5.
Yeah. Never less than this, but if possible, more. Wear a mask if you are in public, if you are with other people, and try to not touch your face. Try to not take off the mask in between. I know it's not a nice feeling to wear the mask, especially when it's super hot outside, super humid outside. So you are really, you want to take it off just for a moment, but then your hands are so close to your mouth, your nose, your eyes while you're taking off this mask. Better wait until you are at home, until you've washed your hands, then take off the mask only here. Don't touch the mask here, only here on these bands. Take it off, throw it away, or put it in the washer, and then wash your hands again. Always with soap and water, especially before you want to eat or feed a child or another person that needs help. What else? Avoid gatherings of people if possible. I know it's maybe not always possible, but if possible, try to avoid it. And if not possible, wear a mask and still try to keep your distance. In closed rooms, try to open a window so it's well ventilated and the air is not moving. That's really bad. If you have to cough, use a disposable tissue or your inner elbow. And if you don't have anything else, do this. This helps as well. But just don't cough like this. And especially, I've seen that a lot. People, they wear a mask, then they take it off, and then they cough because they don't want to cough into their mask. But this is what the mask is for. So if you have to cough and you wear a mask, just cough into the mask and then wash the mask afterwards or throw it away and use a new one. And really, really important, if you are feeling sick, stay at home. Don't go to work, don't see any friends, don't see any family. And if your symptoms worse, then try and call a doctor so he or she can check on you.
Yeah, follow the guidance sort of given in your country to if there's a phone number or whatever steps you need to take, and make sure you know those in advance, right? Like it's try not like have that information around for your family or for your friends so that if someone gets sick, they know what the steps to do, because if you're already really sick, you don't want to be having to try and figure out what your next step should be.
Yeah, exactly. But
That's
never
really...
just go to your doctor if you're feeling sick, because you might transmit the disease to other people who are waiting there. Better just call ahead, ask, hey, what are the steps to do? And then the doctor can tell you, hey, yeah, when you should come, what precautions you have to take.
Yeah, especially when you think it's COVID. That's been a really great conversation today, touching on both COVID, but also dengue, and sort of bringing that, the fact that lots of people are still getting sick and there are outbreaks right now of dengue to the forefront. I really appreciate it. Hannah, is there anything else you want to add at this point?
Maybe just, even though dengue and COVID are completely different diseases, I think that COVID is actually an opportunity for us to learn, because right now many people, they really work super efficiently to prevent COVID. And I just hope that in the future people work as efficiently to prevent dengue as well, because they have maybe seen with COVID, okay, if I really do as I am told, then I won't get it. And maybe then they do the same with dengue, and they actually try to keep their neighborhood clean, and they try to wear long sleeves when they're out in the evening to avoid bites, because we live in an area where dengue is present, and we should never forget that it is a serious threat to our health. And even in COVID times, where our thoughts are somewhere else very often, we shouldn't forget about dengue.
Yeah, no, that's a really, really good reminder. And just even the overall reminder to follow the advice of those public health and health authorities and from your local Red Cross, because they're getting the good information and they're getting the information that's tested and true. And that's what they're really looking to share, because their best interest is your health. So as always, thank you so much for joining us, everyone. If you have questions, comments, ideas, don't hesitate to put them wherever you're watching this, whether it's YouTube or Facebook or Twitter. Tweet at us, leave us a comment. We want to hear what you're hearing so we can reflect some of that in the conversations we have in the future. Hannah, thanks so much for joining us. We'll hopefully have you on again. And to everyone else, goodbye, and we'll see you next week.
Bye.
Bye.